So what is coronavirus? Coronavirus is a newly discovered virus, and it was discovered in December 2019 in Wuhan, China. The scientific name for the virus is SARS-CoV-2, which stands for Severe Acute Respiratory Syndrome Coronavirus 2. The number 2 is added to differentiate between this virus and the previous coronavirus that scientists already know about. So where did this new coronavirus come from? It's a zoonotic virus. That means it originates from animals. So far, it seems that it has originated from animals in a wet market in Wuhan, China, and bats are the natural host for this virus. But it seems that it has crossed the species barrier and it was transmitted to a pangolin. The pangolin, which is pictured on the right of the slide, is an anteater that looks very similar to an armadillo. And it seems that once the virus infected a pangolin and then that new mutated virus crossed species barriers again and infected humans, this new form of the virus seems to be more virulent and is leading to all of those negative health consequences that we're dealing with right now in humans. The coronavirus, specifically the SARS-CoV-2 virus, causes the disease COVID-19. COVID-19 stands for Coronavirus Disease 2019. COVID-19 leads to lung illnesses, mainly pneumonia, that could potentially progress to ARDS, meaning acute respiratory distress syndrome. There currently, in April of 2020, is no vaccine nor generally accepted cure for COVID-19. So COVID-19 could lead to pneumonia. What is pneumonia? Pneumonia is when the tiny air sacs in your lungs called alveoli get inflamed and fill with fluids and water. This accumulation of water and fluids within them prevent them from properly exchanging the oxygen with the blood vessels that surround them or the capillaries that surround them. So what ends up happening is that you're breathing in air, but that air that carries the oxygen cannot properly cross over from your air sacs into your blood, and so now you're not getting enough oxygen in your blood. If left untreated, or if your immune system is compromised, it could potentially progress into a life-threatening illness called ARDS, or acute respiratory distress syndrome. What is ARDS? It's a life-threatening illness characterized also by fluid buildup in the alveoli. Most patients who develop ARDS usually already have some form of lung disease and they're already hospitalized. And unfortunately, getting ARDS is associated with a high mortality or fatality rate. What are the symptoms of COVID-19? First of all, it's important to understand that the incubation period for the virus is between 2 to 14 days, which means you could contract the virus and be able to transmit it to other people without having any symptoms show up for 2 to 14 days. The symptoms of COVID-19 may include a cough, a fever, shortness of breath, headaches, and digestive symptoms. Digestive symptoms are present in 50% of COVID-19 cases. And this is important because at the beginning of the pandemic, we did not know just how prevalent digestive symptoms were. And people were getting things like diarrhea and had no idea that they had COVID-19 and were transmitting the virus to other people during that period of time. You can see in the figure to the right the frequency of patients who show digestive symptoms, and you can see the biggest frequency, which is the purple part of it. 47% of patients who had COVID-19 had digestive symptoms like anorexia, diarrhea, vomiting, or abdominal pain. The other 41% had only respiratory symptoms, and 9% had no symptoms whatsoever, asymptomatic. Those are the people we need to pay attention to because they can still transmit the virus without themselves being sick or showing any symptoms. And very, very few of those patients, only 3%, had digestive symptoms but had no respiratory symptoms. Of the digestive symptoms, the most common is anorexia. Around 70% of patients had anorexia, meaning they just had no appetite. That was followed in frequency by diarrhea, and then vomiting and abdominal pain were much rarer symptoms if you had digestive symptoms with COVID-19. How is COVID-19 transmitted? Viruses are assigned a number called R0, also known as R0, and that number signifies how contagious a certain virus is. So if you have an R0 of 1, it means that for every person who has the virus, they will give it to one other person. The problem with coronavirus is that more recent studies have been published that show that it's highly contagious, more contagious than the regular flu, and its R0 is 4.7 to 6.6, meaning for every person that gets it, they give it to around 5 to 6 or 7 other people. Now, the virus can be very rapidly destroyed by high heat. So if you apply heat to it at 132.8 degrees Fahrenheit or 56 degrees centigrade, at that point, the virus is deactivated, it's completely killed. However, we need to pay attention to how long the virus remains alive on different surfaces. The virus can be in the air in a certain room if a person had the virus for up to 3 hours. It can remain on copper surfaces for up to 4 hours, on cardboard surfaces for up to 24 hours, and on plastic and stainless steel surfaces for up to 2 to 3 days. The virus can infect the person if it comes in contact with their eyes or their mucous membranes, like the inside of the mouth and the nose, or if you have a wound or a cut in your skin and the virus gets on it, then that's how it can infect you. There is currently no vaccine to prevent coronavirus disease or COVID-19. For that reason, prevention is paramount at the moment. So make sure you wash your hands regularly for 20 seconds with soap and water or an alcohol-based hand rub. Cover your nose and mouth with a disposable tissue or flexed elbow when you cough or sneeze. Avoid close contact with people who are unwell. Ideally, 6 feet is better than 3 feet, but at the very least, you need to be away from other people for 3 feet. Stay home and self-isolate from others in the household if you feel unwell to prevent giving them the virus if you might have it. Especially if you leave the house, do not touch your eyes, your nose, or your mouth if your hands have not been washed properly for at least 20 seconds.